Hello, everyone. Thank you so much for scheduling your first visit with Montgomery Fertility Center. I'm Dr. Famuyiwa. I'm the medical director of Montgomery Fertility Center. I just wanted to take a few minutes to do some housekeeping things with you before your visit. Please take the minute, please put up with me and take a few minutes to watch this video in its entirety. One of the things I like to do is I call it gathering data, gathering information. That's what this is all about. We're like a Sherlock Holmes. We have to gather data before we know what to do anyway with you or for you. So part of the things we like to do is have a workup. Now I'm going to share with you what that is. So I'm going to show my screen here in a second. Um, so one of the workups that we need to have done, and the reason I'm showing it to you now is because you may be getting your menstrual cycle before I see you. And if things are not done at a certain time of your menstrual cycle, it will simply delay getting the information. So if you're so inclined, when you get your menstrual cycle, we like to check the hormones that control your ovary, right? That control your eggs. To that end, within the first, I would say 2 to 4 days of your menstrual cycle, from day 2 to 4, with day one being the day of full flow, it's good to check these hormones called LH, FSH, estradiol, and progesterone. Those are the hormones that from the pituitary gland that kind of control your ovary. So and also we check what is called the anti-Müllerian hormones. I'm trying to highlight this here so you can see these hormones here. Um, so these hormones here, we try to get it on this between, again, like within 2 to 4 days of your cycle. If you can do it on the third day of your period, that's super. If the fourth day of your period falls on a Sunday, then you might want to go on a Saturday or on a Monday, and that's okay. The reason being, if you don't do it in that time frame, the numbers are very, especially for this first four, they're useless. If you do it mid-cycle, they don't really give us the data we need. So it's better if it's done within that time frame. Um, the other blood work that we usually are required to do, we live in the state of Maryland, we're required to check what we call serology, which is basically HIV, hepatitis B, hepatitis B antigen, not the antibody, B antigen, hepatitis C antibody, syphilis, and HIV. Now, if you're going to get blood drawn on the third day of your period, I usually figure, why go for 2 sticks? Try to do it at the same time. The other lab work that I usually look at are things that has to do with your overall health. So we normally check thyroid screen. So we would look at your TSH, your T4, your T3 to make sure your thyroid is normal, right? Because if your thyroid's abnormal, it could affect your fertility. We look at your CBC, make sure you're not anemic, PT-PTT level, and then we do something, we check your prolactin. Prolactin is made from your pituitary gland. It can, however, if it's produced in excess, say from a benign tumor that you're not aware of, it can disrupt your cycles, can affect fertility. Then we want to check if you're rubella or varicella immune. That's really more important for your OB doctors when you get pregnant. They want to make sure that you've been vaccinated with this, and we can check your immunity level. One of the other things we check is your blood type. Are you Rh positive, for instance? Because if you are, or Rh negative, because if you're Rh negative and your partner is Rh positive, then you're at risk for having antibodies produced against your baby. So that's really important to know what your Rh positivity is, or negativity for that matter. The other thing is your comprehensive metabolic profile, which is number 17 here, gives an idea of what your overall health is like. I do a 17-hydroxyprogesterone and a DHEAS. These two hormones are critical for evaluating if you have any adrenal disorder, such as congenital adrenal hyperplasia. It may be abnormal in some PCO patients. And then I look at free and total testosterone. That's important for our PCO patients. If you have excess androgens, that could also have an impact. And I do another screen for whether you're diabetic, pre-diabetic, or insulin resistance by checking a fasting insulin and a fasting glucose, as well as a hemoglobin A1C. So then the next thing we look at is what's going on with your uterus, right? So when you're trying to get pregnant, we want to establish that you have eggs in your ovary, but we want to establish that you have sperm. I'm going to get back to that in a second. But we want to make sure that the uterus is okay, right? Because if something's off in the inside of the uterus, the embryo is not going to stick in. We want to make sure, do you have any polyps? Do you have any fibroids coming out into the cavity? And for that matter, are your tubes open, right? So normally your egg comes out of the ovary and it gets picked up by the tube, which is kind of next to the ovary. The egg picks up in here, sperm comes from below, it fertilizes the egg inside the tube, and then the embryo that results is moved to the cavity. If the cavity is normal, then it'll implant. If it's not, it'll keep going. Now, so critical to this is you want to make sure you have normal tubes. Is the tube open? Because if the tube is blocked, the sperm and egg are not going to meet. If the tube is destroyed, such as this one here that's blown up like a long balloon, this is a damaged fallopian tube. Even if it's open and you manage to get an egg in it, the egg and the embryo that's made is never going to make it to the cavity because this tube is damaged. It cannot move the embryo. What happens instead is the embryo lodges in here and creates what is called an ectopic pregnancy that can actually be serious. It can burst and cause serious bleeding. Um, in addition, if you have a damaged tube, let's say we somehow get an embryo into your cavity, if this tube is swollen like this balloon, it typically contains fluid that can flow back into the cavity and flush out the embryo, or could not even be conducive to proper health of the embryo. So you want to know what the state of the tube is, right? So how do you do it? Well, we can check a sonohystogram, which is where saline is put in your uterus, and you do an ultrasound. That only tells us about the cavity. To know about the tube, you need a dye study. The radiologists will do it. They inject dye into your uterus and take X-ray pictures to see if anything's filling the cavity and to see if the dye comes out of the tube to establish if the tube is open or not. And if it's also damaged, we can see it on this study. It's called the HSG. There's another study called the hyphocyte that you can do to see if the tubes are open or damaged as well. It's not as good at looking at the cavity by itself, so you may need to combine it with an additional test. So the HSG kind of does both at the same time. How is this done? This is done by scheduling it for right after you finish bleeding. The only thing is the radiologist wants you to call them at the beginning of your period before they schedule it. If you don't call them at the beginning, you simply have to wait a month or two because they're very busy, right? And you would take an antibiotic 1 day before this study is done, because if you have a damaged tube like this, right, you could stir up an old latent infection that could flare up and give you a PID. So normally we would recommend that you give us your pharmacy number and address so we can call in a prescription for antibiotic for you to be used starting 1 day before this dye study, and you continue it for several days out. We have a written form that tells you exactly when. Some people will cramp. They put a little balloon in here before they inject the dye. So some people have some cramping. So I normally advise that you take 2 Tylenol or 2 Motrin before this procedure is done, right? So this will complete the initial screening that you need to answer the question, what's going on with the eggs, what's going on with the uterus and the tubes. The other thing that we need is what's going on with the sperm. So you need a semen analysis. The male partners need a semen analysis. And we also have to check hepatitis B antigen, hepatitis C antibody, HIV, and syphilis in the gentleman as well. One thing that's not on here it's in your part of the paperwork that you filled out is to consider doing genetic carrier screening. There, we give you that information. What is genetic carrier screening? Is simply to rule out that you're a carrier for something that could be transmitted to your baby if both of you are a carrier of the same thing. So most commonly, people may know about sickle cell disease or cystic fibrosis, but there are so many other diseases that could be transmitted. And you want to be aware if you're a carrier so that steps can be taken to mitigate against having your child having a full-blown disease that could potentially have serious consequences. So again, I'm going to show you pictures of what I've been talking about. I talked about the ovary housing your eggs, right? And the egg is released from the ovary. It's picked up by the tube that's close by, and sperm actually comes all the way from below, goes into the tube, and fertilizes the egg inside the tube. Once it's fertilized, it starts to divide. It becomes an embryo. And as it's dividing, the tube is moving it down towards the uterus over here. When it gets here, it has gone through several rounds of division, and it now becomes this ball of cells that we call a blastocyst. And the blastocyst is made up of the part that will be the afterbirth, which is the blue-green area here. And the part that will be the baby is this pink clump in the middle of this sphere. So if everything is okay, this blastocyst will implant and the pregnancy continues, right? So that's why we evaluate this. And you can see a picture here of the sperm swimming up the fallopian tubes, seeking the eggs out. And when it gets to the egg, one gets in, the rest of the outer layer of the egg will harden up to prevent other sperm from going through, right? And this is called fertilization. That's what we want. And once fertilization occurs, it starts to divide, and we want it to get to a part where it will become the blastocyst that can implant in the ovary. Now, please, I know it's a mouthful, take a time to sort of go over what I'm mentioning to you. The other thing that I would like to bring to your awareness is additional videos that might be you might find helpful. So what do I mean by that? On my website, so I'm going to share my screen one more time to show you where this is. Uh, um, I have a YouTube video channel called um, um, it's this, you find it at Montgomery Fertility Center. And on this channel, I want you to look up two videos for me. The first one is called The Nature of the Egg. All right. This is a video that I did that kind of goes into a little more detail into how the egg is formed. Why do we worry about the egg? What can damage the egg? How is it, fertilized? How does it, the embryo that's produced divide? And so on and so forth. So please take the time to look at this. I'd really go into a deep expose on how many eggs you have, how many are you born with, how many do you end up with when you start having your menstrual cycle. And you can see there's a steep decline in the number of eggs. And you'll start to understand why I care so much about some of the supplements we recommend that can help you improve your egg quality. The other video I want you to watch is called Understanding, it's a big word, Oligostenospermia. This is a video I did that explains what the semen analysis is all about, what the numbers mean, but more importantly, what the abnormal numbers mean as well. So you want to know what affects your sperm, where the sperm is produced in the testes, what can damage the sperm, and how can you protect your sperm? How can you have the healthiest sperm possible? And what abnormal factors are. So two homework videos for you, the nature of the egg, understanding oligoathenospermia. That would really super help us by the time I see you. Just a few other housekeeping details. We did talk about genetic carrier screening. Please read that in your portal. And if you're interested, let us know so we can have the kit mailed to you. It does take a long time to get the results back. So if you need it, we need to know right away. The turnaround could be 3-4 weeks. Only other thing is housekeeping details. There is a facility fee for any of the equipment used here under Conception Center, and that information is in your portal as well. People normally sign it without reading. I encourage you to please read it, and so you're familiar with the procedures. So again, this is just a quick summary of what we will be talking about. So I figure if I can get you up to speed and educate you on, the preliminary things that we care about when we're trying to help you get pregnant. The more information you have, the better, right? So this is again Dr. Famuyiwa. I welcome any questions you may have. Put it in your portal, send it to me. I would appreciate it. And I look forward to meeting you in person. Oh, one last thing, when you do schedule your appointment, please make sure that we have your proper identification. Your name on your insurance card has to match your name on your government issued ID. The reason we do that is because if you give us any egg, any sperm, any embryo in the future, they are barcoded and tagged, right? So if there's a discrepancy in name, it causes serious confusion. Please take the time to do that homework. And I hope this has been helpful for you. Thank you so much for your time. I know it's valuable, and I really look forward to meeting you. I can't wait to see you. Thank you.